Now coming to the attachments of the vertebrae. On the body, the attachment of anterior longitudinal ligament and posterior longitudinal ligament on the posterior surface of the body of the vertebrae. All the vertebrae are joined by the longitudinal ligaments anteriorly and posteriorly. And the attachment on the lamina. They have that on the lamina. They are attached to each other by the ligamentum flava. From all the thoracic vertebrae, they are attached by ligamentum flava on the lamina. The transverse process, they give attachment to costotransverse ligament. The anterior surface of the transverse process is attached to the neck of the corresponding rib. The anterior surface of the transverse process is attached to the neck of the rib by the costotransverse ligament, and the tip is giving attachment to again lateral costotransverse ligament, which is attached to the tubercle of the rib from the transverse process to the tubercle of the rib. And the lower border of the transverse process is giving attachment to superior costotransverse ligament, which is attached below to the neck of the rib, upper margin of the neck of the rib. Now this spinous process, this gives attachment to interspinous muscles, supraspinous muscles, and the ligament trapezius muscle, and rhomboides major, minor, then latissimus dorsi, serratus posterior superior, and serratus posterior inferior muscle, and the medial group of erector spinae. So all these are muscles of back: interspinous, supraspinous, and trapezius, rhomboides major, minor, latissimus dorsi, serratus posterior superior, serratus posterior inferior, and the erector spinae muscles. All are attached to the spinous process. Now this notch, the inferior inferior vertebral notch, transmits the spinal nerve, corresponding spinal nerve. If this is T4 vertebra, this nerve passing will be fourth spinal nerve. Now wherever the articulation is there, here the head of the ribs below, above and below, and the superior and inferior costal articular facets, they are giving attachment to the capsules. Here is the attachment of costovertebral joint, and here will be the attachment of intervertebral joint. The capsule of the intervertebral joint attaches to the margins of the superior and inferior articular facets, and the costal facets gives, the margin of the costal facets gives attachment to the capsule of the costovertebral joint, capsule of the costovertebral joint. So this finishes our vertebral part. We'll start with the rib.